David H. Song, Cynthia Chow Professor of Surgery, Chief of Plastic Surgery, Vice Chairman for the Department of Surgery at the University of Chicago Pritzker School of Medicine in Chicago, Illinois. It was back in high school when actually a vascular surgeon came and gave us a talk on blood vessels. And so back when I was a senior in high school, I just saw the amazing things I could do with sewing blood vessels. And then of course, the love of that and the fascination of that was developed in medical school, where I saw blood vessels being sewn on a very, very small level on micro-vascular surgery, and that's really what sparked my career. It's the immediacy of the finesse and the result that you see. It's the technical challenge of sewing these small vessels under a microscope, and it's also the creativity that packages everything together to allow us the freedom to expand really a limitless set of flaps that's only limited by your imagination. Yeah, I've been very privileged from the early 90s as a medical student to see microvascular surgery develop into a new era of composite tissue allotransplantation with hand transplants and face transplants, all with the fundamental basis of microvascular surgery. And it's been wonderful to see the transformation from microvascular surgery being a success to be celebrated with each and every case, to now a routine mechanism and tool for reconstruction, and really beyond that to the imagination of face transplants and hand transplants. Well, I've been a big fan of Dr. Nelligan from afar, and we've met. We had the chance to meet at several symposia and meetings, and that interest and that friendship there sparked this relationship, and I was honored to be asked by Dr. Nelligan to edit Volume 4. This plastic surgery textbook, the voluminous textbook that we've known and have developed and have developed into what it is now, is really the sine qua non, the knowledge basis of all of plastic surgery. It's encyclopedic, and it's virtually the Bible of plastic surgery. So as a medical student, as a resident, as a faculty member, that was the basis for all our inquiries and all our foundational knowledge building factual resources. And so that has been the compendium of plastic surgery, and that has now developed into this new textbook, which I believe is really sort of advanced, looking into the future, and really sort of giving us a leapfrog advantage of knowledge that's collated and that's hopefully living and breathing as we continue to edit online. Well, out of my volume, we've had just sort of the world leaders of each subject matter that participated in my volume, and I can't pick one chapter because all of them have been so outstanding, but the video adjuncts to each chapter have been phenomenal. The up-to-date references are wonderful, and just the way it flows across the entire volume has been wonderful. And so the privilege of working with the world leaders of their specialty and their field in one volume has been just an honor and a privilege. Motivation is for me to leave a legacy of knowledge and education. As a program director of our residency program, it's important for me to be a part of that knowledge and to be a part of passing on that knowledge, an example of that as well. That's really the motivation behind this. Obviously, without my family and my beautiful wife and 3 daughters, this doesn't have much meaning, and all work really loses meaning. So thanks to them and their patience and their encouragement is really how this really sort of comes to fruition.